public health priority for us to understand the risk factors for this vulnerable group to avert further occupational transmission. To achieve the highest level of effectiveness in the response to the COVID-19 outbreak, there is need to use the strategies and practices recommended in the national guidelines and protocols for infection prevention and control of COVID-19 spread. Therefore, it is important to emphasize the role of county and facility infection prevention and control programs with dedicated and trained teams supported by leadership at all levels. It has been noted that transmission of the disease among health workers is associated with overcrowding, lack of established practices of infection control, and poor implementation of infection prevention control guidelines and protocols. Other factors include inadequate training in infection prevention and control measures for both the frontline staff and support staff in health facilities. Lack of this training and knowledge leaves them exposed to respiratory-borne infectious diseases due to lack of personal protective equipment, while in other situations it is the poor understanding of the virus. Fellow Kenyans, in the context of the rapidly evolving COVID-19 pandemic, occupational health and safety systems are critical. There is need to institutionalize structured implementation of infection prevention and control measures in health, in our health facilities, in order to minimize transmission of COVID-19 among health workers. By doing so, this will also prevent interruption of service delivery and allow ongoing provision of safe and quality essential health services, while at the same time prioritizing patient and health workers' safety. Infection prevention and control strategies to limit transmission in healthcare settings include the following. 1. Isolating patients with suspected COVID infection and encouraging healthcare workers to have a high level of clinical suspicion. They should also establish a well-equipped triage station at the entrance of every healthcare facility, supported by trained staff, to promote hand hygiene and respiratory hygiene as essential preventive measures. 2. Applying standard precautions for all patients at all times by putting into consideration widespread community transmission. Standard precautions include hand and respiratory hygiene, the use of appropriate personal protective equipment according to risk assessment, injection safety practices, safe waste management, proper linens, environmental cleaning and sterilization of patient care equipment. 3. Administrative controls and policies for the prevention and control of transmission of COVID-19 infections within the healthcare setting will ensure that infection prevention and control measures are implemented. These include educating patients, caregivers, implementing policies on the early recognition of acute respiratory infection potentially caused by COVID-19. It will ensure access to prompt laboratory testing and quick turnaround times for results to minimize contact and exposure to positive cases. It will also prevent overcrowding, especially in the outpatient and routine clinics, provide dedicated waiting areas for symptomatic patients, and appropriately isolating hospitalized patients. To further reduce the risk of transmission of the disease among healthcare workers, there is need to monitor them to comply with standard precautions and providing mechanisms for improvement as needed. This can be done through regular health worker risk assessments, adjusting workflow processes to ensure rapid triaging and separation of suspected COVID-19 patients. Okay, let me, fellow Kenyans, now turn to our statistics on COVID today. Wananchi wenzangu, hebu tujaribu leo tuwaletee hii habari kwa Kiswahili. Hali yetu ya janga la corona katika nchi leo. Leo tumepima sampuli 14,261 na kati ya hizi masampuli ambapo tumepima 461 zimepatikana kuwa positive. Kwa jumla wale watu ambapo wako nchi na ni positive ni idadi ya 11,252, na kwa jumla zile matest ambapo tumefanya mpaka leo ni 225,495. Kati ya hawa watu 461 ambapo wamekuwa positive, 320 ni wanaume na 141 ni wa kike. Mdogo wao ni mtoto ya mwaka moja na mkubwa ni mzee wa miaka 86. Mia nne na 32 ya hawa 461 ni wa Kenya na 29 ni wageni. Kwenye sehemu zile hawa watu wamepatikana, Nairobi ina watu 248, Machakos 97, Kiambu 20, Kajiado 15, Migori 14, Busia 12, Nakuru 11, Laikipia 7, Nyeri 7, Kilifi 6, Lamu 4, Uasin Gishu 4, Kakamega 3, Kisii 3, Kisumu 2, Makueni 2, Mombasa, Taita Taveta na Bomet 1 kila county. Pia leo tuna furaha kuwaeleza ya kwamba tumeshawacha kutoka hospitali patients 51, na kwa sasa tumefika wale watu ambapo wameshapona kwa hii virusi, idadi yao sasa imefika 3,068. Healthcare workers wetu ambapo wanafanya kazi safi sana, tunataka kuwa congratulate kwa kazi ambapo wanafanya kule kwa wakati hii. Pia tunataka kueleza leo tumepoteza watu 7 kwa hiyo ugonjwa, na inaleta ile idadi ya watu ambapo wameshafariki kwenye hii ugonjwa kuwa 209. Tunatuma rambirambi zetu kwa wale watu ambapo wamepoteza watu wao. Finally, I once again want to thank our healthcare workers for the great work they are doing in our various health facilities, especially during this very difficult time of this pandemic. I cannot have better words to thank them other than assure them of the continued support and cooperation from the ministry as they undertake this noble duty. Asanteni sana.
Raquel Mugai from Citizen TV. The National Treasury and the Ministry of ICT headquarters have had to scale down their workforce after some staff members tested positive. These staff members worked at Teleposta Towers, which houses the Ministry of ICT. So basically, what is the testing in these offices, as well as what is the government strategy in trying to reduce the transmission of the virus in public offices? And finally, is Kenya playing a role in a global effort of finding a vaccine, given that the Moderna vaccine is moving to its final trial in the next few weeks?
Thank you. My name is Gina Kirari from NTV. I'd like to inquire about the efficacy of the testing kits that are being used in the country. We know a majority of them are those that were given by China, and India rejected a few of those sample kits, so I'd like to know if the efficacy is up to date. Another question is, what is the status of the backlog of the samples being tested? Are we truly up to date with testing, or especially after issues such as the reagents not being able to be found and the gap in the testing at the end of June? And then lastly, what is the future of sports in the country? We know right now it's a tricky time to return back to sports, but what is being done to compensate the sportsmen and women in the country? Thank you.
Emmanuel To kutoka runinga ya KTN News. Swali moja tu. Je, kuna wahudumu wa afya walio katika hospitali ya Mama Lucy ambao wameweza kuambukizwa ugonjwa wa corona? Kunao ama hawapo? Asante.
Nancy Okware kutoka KBC. Swali langu la kwanza ni kuhusiana na hali ilivyo kufikia sasa katika hospitali ya Pumwani. Je, ni hatua zipi zaidi ambazo zimechukuliwa ili kuhakikisha kwamba shughuli za kawaida zinarejelewa ili Wakenya wasio wanapata matatizo wanapokwenda pale? Na mwisho kabisa, ningependa kufahamu kuhusiana na wale wagonjwa ambao wamepona kutokana na virusi vya corona humu nchini. Je, wanapoondoka pale hospitalini ni kipi ambacho kama wizara huwa mnawaambia, manake wamo katika hatari vile vile ya kuambukizwa virusi vya corona? Je, ujumbe upi ambao huwa mnawapa, pengine chakula ambacho wanastahili kula? Je, huo mtindo umezingatiwa humu nchini? Na vile vile kumekuwa na wale ambao wamepata virusi vya corona kwa mara ya pili baada ya kupona. Shukran.
Thank you. Zainab Mohammed, TV 47. What are the projections in terms of infections in the coming days, seeing that we are seeing a rise of numbers every single day? Number two, we have seen a rise in the number of state agencies reporting positive cases. Is this a concern to the ministry? The last one, why can't NHIF cater for testing, especially for the hoteliers? Thank you.
Can you repeat your last part, please?
Why can't NHIF cater for testing, especially for hoteliers?
NHIF.
Yes.
Okay, thank you very much. This is quite a series of questions. Some of them I will respond to, others my technical support team will respond to them. Rachel, Citizen, your question was regarding the ICT ministry, and particularly at Teleposta Towers, what's happening there in terms of staffers there who are said to have tested positive, and what are we doing about public offices and public offices where people are turning positive. The first part of your question. Let me respond to that. At this time and period when we are beginning to see that our numbers are increasing, as you know, we have evolved through this pandemic and through our trajectory. In the beginning, we were dealing with mainly protecting ourselves from imported cases of COVID-19, because the COVID-19 came from somewhere. It had to come from outside. You remember we had our first case of an individual who originated from the US, passed through London. So that effort continued to protect the country by making sure that those coming in do not bring in the virus, and hence all those measures that we put in place, the cessation of air travel and so on. But once the virus came into the country, there has been transmission, human-to-human transmission, and what we call community transmission establishing itself. And for a while now, we have had community transmission, because you can see we now have transmission of the virus in 42 out of our 47 counties, which means that we now have well-established local transmission or community transmission of the virus. And then, given that, therefore, it is going to find its place in many places. The virus will find itself in many places. Public offices, high offices are not an exception. We will continue to see many different places where we will find that there are cases of infection, that there is spread of infection, and we need to be able to move in quickly and try to stop that spread of infection. So if we have today infection cases at the ICT offices, I think it is not a matter of surprise. It is an expectation of the spread of this virus that we will continue to see it, but we must take the right action to try to contain it, to stop it by going in there quickly, identifying the scale of spread of the infection, identifying the people who are infected, and being able to contain them so that they do not spread the virus any further. So I think that answers to the question that going forward, the virus will show up its ugly face in many different places, and we should be ready for that. We're going to see that, and we should be ready for it. The second question was to do with our role as a country in the vaccine tests that are going around the world, that are going on in the world. Yes, there is a lot of effort globally on trying to find a quick preventive agent against this virus. There's a lot of hope that is hinged on discovery of a vaccine that works. That would be good, but vaccine discovery and vaccine takes a long time. However, there is a lot of effort in fast-tracking this, and I know that there are more than 200 different efforts globally at vaccines, but only a handful of them have reached a point where they are being moved forward with some level of promise. The vaccine that you may have talked about, where we as Kenya might be involved in, is a vaccine that is being tested out of Oxford University, and one of our institutions, the Kemri Wellcome Trust Institution, is involved in that trial. It hasn't yet begun here in Kenya, but there are indications that we will be involved at some point in assessing the efficacy of this vaccine. And when that time comes, we will let you know. But there is a procedure and a process for us to go through before we accept to be involved in a trial of a vaccine or any therapeutic product for that reason. And we have the structures and necessary review boards that look at that. Gina of NTV, your question was regarding the efficacy of our testing kits, and you also cast aspersion on the donations we received from China, which you say some places rejected them. Let me speak on the issue of donations. The very early tests that we did, and for a long time, for quite a while after that, that supported our testing effort, were donations that we received from the Jack Ma Foundation. Those test kits were tested and evaluated in our labs, and they were found to be fit for the purpose. And in fact, were it not for those kits that we had at that time as a donation, we would not have made the progress that we have made in our testing capability. I think that donation made a big difference in our testing program, and we want to say that we do appreciate that donation that came from Jack Ma through the Africa CDC and other efforts, and it worked for us. There are many donations that have come around, and when you talk about testing, we need to be very specific about what type of testing we're talking about. The standard gold testing technique is what we have said repeatedly here, real-time PCR, and that's what we use in this country as our confirmatory test for PCR, for coronavirus. Those kits that we obtained are for this test, and they worked for us. I don't know what the nature of the tests that were donated in a place like India and that were rejected were. They could very well have been some of these other non-standard tests, such as the rapid diagnostic tests that we spoke about before. But those donations have helped us. Again, I want to say that yes, donations, when they come, must also be put to scrutiny to see that they meet our standards. As long as they meet our standards and support our effort, we welcome them. The status of backlog of samples, maybe the DG might talk on that, but I do know that over the last several weeks now, we have had enough testing kits, more than 182,000 kits that we have had over the last 3-4 weeks. You have seen the scale of testing that we have been carrying out, more than 4,000, 5,000, 7,000 tests sometimes over 24 hours. That indicates that we have had these reagents and we are able to continue with that testing. And I believe that we must by now have worked through whatever backlog that we may have had in those tests. Remember also that we have two different platforms for testing. We have what we call the high throughput automated systems that use a different set of testing kits, and then we have the manual systems that use another separate set of kits. So at any one time, it could be possible that we may not have enough of one set, but we may have sufficient of the other. And finally, your question was regarding the future of sports in the country. Well, you know, we can see we have opened up in certain sectors of the economy. Sports contributes to our economy. It also contributes to the well-being of our people. And clearly, we must do what we can to try to get our sports system working again. In many parts of the world, sports activities have opened up. And it depends on the nature of sport that we're talking about. I see no problem with those individual no-contact type of sports. And I think that is happening in many places. Ours is largely an area where we excel in the area of athletics. Athletics are individual sports, mostly non-contact. We would like to see a situation where our athletes can go out there and compete and bring fame and glory to our country. And I think we will work on that to see that that happens. As for sports that draw gatherings and public gatherings and contact sports, I think those considerations of whether it's possible to allow those sports to continue without endangering those that the fans that go and watch these sports needs to be considered very carefully along the lines of the procedures and protocols that we have put in place. KTN, you also talked about huduma, you talked about healthcare workers being affected in Mama Lucy Hospital. I think I have addressed the issue of us seeing that we will find infections springing up in many different places. So I will not dwell on that anymore. Nancy Okwaro, you asked about Pumwani, what is happening in Pumwani, and what actions are we taking as government. You also wanted to know how do we deal with those who have recovered from the virus, and what kind of advice do we provide them as they recover and leave the hospital. Dr. Ahmad, since he was there yesterday, I think we'll talk a little bit about what's happening in Pumwani and the actions that we have taken. But with regard to those who recover, we do what is required according to protocol, and that is recoveries are based on release from hospital once we have established that those individuals have fully recovered. In terms of if they had any clinical symptoms, that those clinical symptoms and conditions have resolved themselves, but really that they no longer have the virus in their system. So we have to test them to ensure that they are virus-free by the time they are being released out of a health facility. And that ensures, therefore, the issue of them being able to transmit the virus does not arise because they are only released once they are free of the virus. The advice that they are given that this is a new disease that has, I think in recent days we have seen that we are beginning to get a little, much more information on the pathophysiology of the disease, how it affects different parts of the body, the long-term effects of the disease on certain functions of the body. I think we are incorporating all that, taking it up, and we are ensuring that these people whom we release, we give them the right advice, we ask them what to watch out for, and we give them the necessary advice in terms of how to keep themselves healthy, how to keep themselves virus-free, and how not to be in a position where, you know, in the event that so that they get reinfected. We don't even know whether people who have, with any certainty, and I know that question was asked, we do not know with any certainty whether people who have recovered from coronavirus get reinfected again. There may have been some cases here and there reported, but it cannot be said with certainty, and there isn't enough evidence base to be able to tell whether people who actually recover from the virus stand a chance of being reinfected. This is an area of intense research because it is important to know. It's important to know the immune response mounted by individuals against the virus and how long that protection lasts. These are important things to understand the epidemiology of the virus, because once you understand that, then you can develop strategies on how to stop transmission. So that is an evolving area of knowledge, and we look forward as this knowledge base increases to come up with some indication on how to deal with the virus. Projections, the last person to ask a question wanted to know projections of infections in the coming days. The increased number of cases in state agencies, I think I have addressed that, and whether NHIF can cover the costs for testing, especially for restaurant workers. In terms of projections of infections in the coming days, I think we are seeing, and we have said that a time will come when our numbers will rise. As we approach the steep incline indicated that we may be approaching our curve sometime in August or September. So far, the rises that we are seeing seem to be consistent with that, and therefore I think we'll wait and see. But we know that projections sometimes do not bear the truth. That will wait to be seen. But clearly we are seeing the number of cases increase. The numbers that we have been announcing in terms of those that are positive from the total samples, the rate of positivity seems also to be increasing, an indication of increasing numbers of people who are infected. So we'll continue to see that. NHIF covering the costs of testing. You know, I think it's not only NHIF, the entire insurance industry, I think, is in a situation where they have now to look at and review their policies, because coronavirus was not there before. It was not there when the policies were set and the exclusions and inclusions were set. I think it's a process now of reviewing this and seeing what it means, what the implications are in terms of cost and what can be covered. But I can tell you that these discussions are ongoing, not only with NHIF, but also in the private insurance industry. I will now hand over to Dr. Amoth, maybe to respond to some of the questions that had been raised. Dr. Amoth.
Thank you, Waziri. Let me start with the last one of additional information in terms of the projections. Is, as Waziri has clearly stated, is that the numbers will increase as we approach our peak. And if the numbers increase, of course, even the deaths will significantly increase. But more worrying, of course, is deaths, especially in those without coexisting medical conditions. Like for today, we have reported 7 deaths. Out of these, there are 2 people who didn't have any coexisting medical indication or condition. So that is usually a source of worry for us, because then it means either the infection is they are getting a more serious form of the infection, which therefore means that we need to be able to warn the young people that not everybody who gets COVID, you could be that unlucky person who gets a more serious form of COVID-19 and therefore succumb to it. So it is imperative that the young people take these precautions very, very seriously. Initially, in early phase of the disease, remember most of the people who died had coexisting medical conditions. But also as the numbers rise, the healthcare system, in line with the directive of His Excellency the President, that each county establishes a 300-bed isolation facility, a number that very many counties have indeed exceeded. The healthcare system has been resilient and people are still able to get services. So we are pleased that on the 10th day following the lifting of the restriction of movements, so far the healthcare system has responded very, very well. As of today, we have 1,049 people admitted across hospitals in the width and breadth of this country. And out of these, 39 are in ICU, with 21 of them under ventilatory support, meaning we are breathing for them through machines, and 18 requiring supplemental oxygen. So the number has not changed significantly in the past 3 days. So we hope that scenario will obtain going forward. There was a question in terms of sports, which Waziri has also articulated too, but CS Mina Mohammed, CS for Sports, has formed a task force to which MOH is a member, to be able to provide technical expertise in development of protocols and guidelines that will enable us to resume sports activities while assuring safety, public health safety of the Kenyan people and the individual athletes. There was a question of Pumwani. Yes, yesterday I was in Pumwani with my dear sister to my left, and on a fact-finding mission, and we indicated that 41 out of 290 healthcare workers had tested positive for COVID-19. 2 had subsequently recovered and been removed from isolation, but 39 were still on home-based care isolation in various places in Nairobi. And the support that the ministry has extended to them includes, in our meeting yesterday, the need for further capacity building and sensitization of the healthcare workers on case management, provision of additional personal protective equipment for safety of the healthcare workers as they deliver on their mandate. We are also ramping up infection prevention control guidelines in the hospital, the issues of hand washing, use of sanitizers, masking, and of course physical and social distance, including closure of common areas where healthcare workers tended to gather, like the tea room near the labor ward. The hospital has also, in conjunction with Nairobi Metropolitan Services, established an isolation facility for healthcare workers who may not qualify for home-based care, and of course will continue to offer them continued psychosocial support during this difficult period. But of note is that these 39 in Pumwani none of them were symptomatic, and none of them had any underlying medical condition. So we are very, very hopeful that they'll be able to pull through. Yesterday and today, again, we commenced testing of the remaining 100 healthcare workers, so the total complement of about 390 healthcare workers in that institution will be tested for COVID-19, and the same measures will apply in case anybody turns positive. The issue of recoveries, I think Waziri addressed that very, very conclusively. But also to be able to add to that is, of course, we continue to offer them psychosocial support, advice on nutrition, the kind of foods to eat, and of course the need to maintain other infection prevention control measures that apply to all of us. The status of backlog, yes, again, I want to confirm we don't have any backlog of cases, because in the past 3-4 weeks, we have had sufficient quantities of test kits and reagents, and therefore we have tested as we pick the samples. But as countries move on again to reimpose restrictions, like what is happening in America, going forward there could potentially be challenges in terms of acquisition of these important commodities. So we could again get into headwinds going forward, but we'll always do our best as a government to ensure that our testing is sustained. There was a question of the vaccines. Yes, something exciting coming from Moderna, which is a biotechnology company in America, using a totally new approach to development of vaccines. They're using part of the virus, inject it into your body, and that particle is called mRNA, messenger RNA, which stimulates the production or formation of a protein that is found in corona called a spike protein. This spike protein is like a pin that enables it to attach to and infect the other cells. So once it infects the other cells, then your body naturally, because this is a foreign antigen or a foreign body, produces an immune reaction leading to formation of antibodies. And it is this that we need, because these antibodies then, if you form them in sufficient quantities, if you then get into contact with the real coronavirus, then the antibodies will be able to neutralize it and prevent you from getting infection. So this Moderna vaccine has gone through phase 1, where it was tested in just a small number of people to look at 2 issues. One is safety, and of course number 2 is whether you develop an immune reaction if you are given the vaccine. And out of the 45 people who are given the vaccines, all of them developed an immune reaction. They produce antibodies. Of course, the highest antibody production was noted in the last group, which was given a higher dose of 250 micrograms. But also because of the higher dose, they experienced the greatest side effects, including headache, muscle pain or myalgia, fever, nausea, and delirium. So going forward, a 250 microgram dose will be pulled off as we go to phase 2, where we are now going to test the vaccine in thousands of people. You remember we started with 45 in batches of 15. So now we can go into hundreds and thousands. Then in phase 3, we continue again to monitor for safety and immune reaction in hundreds of thousands. So this going forward is good progress, but again with a caution that even if you are to get the virus, of course, probably the people in the first world will be able to access it first before it comes to the developing world. And you have seen the kind of protectionist measures that the countries have put in place. So we think going forward some countries will insist on those tendencies. But the natural best thing to do once you develop the vaccine is to avail it to everybody. Because corona anywhere is corona everywhere. I think that is all for today. Thank you.
Thank you, Amot. I want to make a correction. Nimeelezwa ya kwamba wakati nilikuwa nikisema wale ambapo tumetest ni 4,261. Naambiwa nilisema 1,400. 4,261. Anyway, you will be getting the statistics and the document here with the correct figures. Thank you very much. What we want to do next is we have some innovators, local innovators here who have come up with some innovation which we want to test and see how this innovation works. And we want to encourage our people to use their abilities and innovation and come up with products and ways in which we can support the COVID response. Thank you.